A really great question we've recently received is, how accurate is computer imaging?
Yeah, computer imaging for us is an indispensable tool as part of the consultation process. Whether you're coming from out of country, out of state, and coming in to have surgery, or whether you're here locally, a really important part of surgery is for us to be able to show patients exactly what they can expect to achieve with the particular procedure we're discussing. And in short, the answer about imaging, how accurate is it, is very accurate.
It entirely depends on the surgeon and who's doing the imaging. So you can Photoshop anything, you can computer image anything, but that's not really the art. That's not what this is really about. You need to have a real honest conversation with the surgeon about exactly this topic. Is the imaging you're doing sort of just a gross fantasy idea of what's possible, or is it really the sort of surgical plan that you're looking to achieve? And that's really important. For us, that's the way we do it. What we're doing when we're images, we're analyzing your face, your structure, and listening to you to get a sense of what makes sense for you, and the image that we're doing then corresponds to the result that you should expect.
Yeah, so rather than using imaging as sort of characterizing an ideal that I think a lot of surgeons might be uncomfortable being held to, really for us the standard is imaging is a really useful tool to give patients a really realistic, very honest sense of what's possible and what we recommend. And it's a really stepping stone for us to have that conversation.
Yeah, so along those lines, it's important if you're going to see somebody and do this sort of work to have this conversation, but also along all of this is the idea that you want to see the view in every view. You want to see every angle. You want to see profiles. You want to see front view. And in our practice, we really stress 3/4 where there's a sense of depth so that you can really understand what you're really going to look like. So for us, indispensable part of the practice.
Absolutely.